Spirometry testing is one of the most common tools used in diagnosing and treating COPD and other chronic respiratory conditions. It's used to test lung function, to diagnose lung conditions, and to evaluate current treatment regimens to ascertain if adjustments need to be made. In this video, we will explain how a spirometry test works, as well as best practices for taking the test. If you've looked at a spirometry report, it may look like a confusing jumble of numbers, but don't worry. If you understand what's being measured, it's easy to interpret your results. We'll explain that as well. First, let's talk about taking your test. On the day of your test, doctors suggest that you wear loose clothing that won't inhibit your breathing. A full stomach will cause pressure up against your diaphragm, making it difficult to breathe deeply, so be sure not to eat a large meal before your test. Hopefully you've already quit smoking, but if not, be sure not to smoke within 24 hours of testing. You should also avoid consuming alcohol or caffeine. Studies have shown that strenuous exercise can cause abnormal pulmonary test results, so avoid vigorous activity for at least 12 hours beforehand. A spirometry test involves a machine called a spirometer that measures your breathing volume. You blow into a tube or mask attached to the machine, and it will record the results. The test generally takes place in a doctor's office and can be completed in about 30 to 60 minutes. As the test is being administered, you'll be seated in a chair. The technician will place a clip on your nose to close both nostrils. You'll be instructed to inhale as much air as you can to fill up your lungs. Then you'll either seal your lips tightly around the tube that is attached to the spirometer, or make sure your mask is secure and tightly sealed. Then you'll exhale as hard as you can. Generally, you'll be asked to repeat this test 3 times to make sure that your results are fairly consistent. The highest value from the 3 tests is normally used as the final result. You may not be able to get feedback right away. Sometimes, a pulmonologist will need to analyze the results. Your spirometry report will record 4 values in regards to your lung function. The total volume of air you were able to blow into the spirometer is the forced vital capacity, abbreviated as FVC, on your report. The volume is measured in liters. Average normal values for healthy males aged 20 to 60 ranges from 4.75 to 5.5 liters. For females aged 20 to 60, the normal range is from 3.25 to 3.75 liters. The predicted column compares the actual total volume exhaled to the average total volume of those of the same gender, height, and age. It's expressed as a percentage of the average value. Values between 80 and 120% are considered normal. The second parameter measured is the volume exhaled during the first second of exhalation. It is abbreviated as FEV1 on your report. This volume is also measured in liters. For males aged 20 to 60, normal values range from 3.5 to 4.5 liters. For females 20 to 60, the normal range is 2.5 to 3.25 liters. The predictive column is expressed in a percentage of predicted values. Again, between 80 and 120% is considered normal. Anything less than 50% is considered severe. The next parameter is a ratio of FEV1 divided by FVC, which is to say the 1 second forced volume divided by the total forced volume. The measured column shows the ratio and the predicted column shows the percentage as compared to predicted values. The normal range is between 70 and 85%. This measurement is important because obstructive respiratory diseases such as COPD cause difficulties in forceful exhalation. An obstructive condition may reduce the percentages to 45 to 60%. On the other hand, restrictive conditions, such as interstitial lung disease or pulmonary fibrosis, tend to reduce both the FVC and FV1 values so that the ratio remains in the normal zone. This helps the doctor to understand the nature of your respiratory difficulties. The fourth parameter recorded during a spirometry test is the total duration of your exhalation time. This parameter is measured in seconds. 6 seconds is considered a standard duration for these tests for accurate results, so you should try to exhale for a minimum of 6 seconds, even if you run out of breath sooner. Now that you understand what the measurements on your spirometry test indicate, you can better understand how to evaluate the results. First, start by looking at the FVC measurement to see if it's in the normal range. Second, look at the FEV1 parameter to see if it's in the normal range. If both your FVC and FEV1 values are in the normal range, in all likelihood your results will be considered normal and no intervention will be suggested by the doctor. If either the FVC or FEV1 values are below the predicted normal volume, there's a possibility that you have compromised lung function. If your FVC is lower than 70%, it's possible that you have some sort of restrictive lung disease, and your doctor will likely order a full range of pulmonary function tests. In general, your forced volume and 1 second value should be above 80%, and your calculated ratio should be above 70% to be normal. If your ratio is below 70%, it's likely that you have some sort of obstructive lung condition. If you have already been diagnosed with a lung disease, you may occasionally be asked to take a spirometry test to evaluate your treatment regimen. In these tests, your FEV1 volume may be measured after you've been given a bronchodilator treatment. The resulting percentage value as compared to predictive values are used to grade the severity of your lung condition. 80% lung function is acceptable. 79 to 71% is considered mild or stage 1 COPD. 50 to 70% is moderate or stage 2 COPD. 30 to 40% is severe or stage 3 COPD. Less than 30% is very severe or stage 4 COPD. Keep in mind that these are just general guidelines, and you should follow your doctor's interpretation of these results. Also keep in mind that even though many lung diseases are progressive, and there may be no cure, it doesn't mean that nothing can be done. Learning proper disease management skills can slow disease progression and ease symptom severity. We hope this video helped to take some of the fear and anxiety out of taking a spirometry test and helped you to better understand the results. Thank you for watching. Please be sure to check out the LPT Medical YouTube channel and Facebook page videos for more informational content. Be sure to subscribe so you don't miss any new videos.